So in developing our theory, I thought this was a very useful quote to have a think about. It's what we gain from academic studies is knowledge, what we gain from experience is wisdom. So as we had a great discussion this morning around smoking cessation, and we've learned a lot around that, and a lot more about the what's we could be doing. And then we'll need to take that theory back, that knowledge back, and put it into a theory of how we might incorporate that knowledge. Okay? So we've done driver diagrams before, but it's something that people sometimes find a bit challenging, and about how you link up your theory for improvement with your action plan and what you're going to do differently. So we've got the improvement journey, and we're all well underway on this, but it's always good to refresh briefly. So we've been doing a lot of work with co-design and working with our consumers and whānau around understanding the problems that are related to seclusion. And then I think that what we've learned while going around visiting is that everybody has sort of seen the problem, that actually this is not just a secondary problem, this is community and a system problem. And that links to, actually, it's a system of care that we have currently and how that contributes to us having the seclusion events that we see. We've all got together, and you've all done pretty good jobs around setting our aims. Now we have that national aim of zero seclusion by the end of 2020. So then we've done some great work around that, and you've all done different work around, been around and having a look at some of your driver diagrams around setting some interim measures to get us towards zero, and that's great. I think that's a really good way to chunk work out. And now you've spent a bit of time in understanding your consumer feedback, service users, Māori consumers, around developing a theory for improvement. What does the system need to do differently to eliminate seclusion? And I think most of you have taken that wider view about what the whole system, which is great. We've also got some measures identified, and we've got some process measures that you're going to work on today, but we've got some clear outcome measures. And most of those outcome measures have the ability to look at it through an equity lens as well. And we've got some balancing measures as well, about making sure that we're using system thinking and that we are looking for any unintended consequences as well. And then we're going to start with those ideas in our theory about testing some change ideas. And then once we've got the right ones and they're working, about how we go about spreading them. So why do we have a theory of practice improvements? Why do we bother with all this? One reason is it creates a common language, and as you notice that you're coming to learning sessions and having coaching is that in quality improvement we do speak a slightly different language. But it is about some of that common themes, and that we have a common theme when we're talking to people and engaging people around that, what are we doing? And that it helps us focus improvement efforts on the most important part of the system. So you've been looking at your systems, what's going on, looking at your data, looking at your co-design information and finding out where are the important parts of the system that we need to be focusing on to achieve that. It helps us show that the changes that we're introducing are related to a theory and an aim. Okay, so that we have a theory about what it is. It is only a theory. So a driver diagram helps us, and it consists of a team's shared theory. So I said a team's shared theory. One of the papers, and we're going to discuss this in a bit more detail, that we have put out for you today is the Psychology of Change Framework. And it's an excellent document. It's recently come out, it's only been out a couple of months, but it's really helpful. When you go through and you read it, which I'm sure you all will, it gives you about that. This is a we thing. This is very much about how we improve together and about using that collective experience and knowledge so that we develop a theory for improvement, because we'll all see parts of the system quite differently, how they interlink and how they work. So creating a driver diagram is a visual representation of that, about what our current theory is about how to eliminate seclusion and what we need to do differently to achieve that outcome. It's intended as a fairly clear and simple depiction of the improvement theory. You won't put everything in there, and as you go along, things will change. You will learn things that work and don't work, and your theory will will evolve over time. So it's a working document, and it's a visual picture, but it's a working document, and I think that's always an important concept, because there's no such thing as a perfect driver diagram. They change over time. The other thing is it does need to be simple, so that it, otherwise sometimes you can put up driver diagrams and they're really complex. That psychology of change, you want to be able to, that it seems doable and that it's relevant. So sometimes you narrow things down or scope the project. So one of the things that we always go back to is the model for improvement. And that drives our development of our theory and about what are we trying to accomplish, so we have that aim. Then we have the measurement component. How will we know that we've got, that the changes that we're putting in place are an improvement? Then what our theory for improvement is, what are the changes that we can actually make? And then we go into testing those. Are they working in our context? Do we need to adapt, adopt, or abandon them? For the improvement project, the driver diagram illustrates what structures, process, and norms are believed there. And you can all see, everything that we're talking about today is linked. They're all linked, and we will cross-talk about things because they're all fit in there. But the driver diagram informs testing, and testing refines the theory. So when you look at it and you start from your aim on the far side, and you work through all the changes around that. And that is about the what will get us to the outcome when you think of left to right. When people are looking at it in the other way, it's about how is that change really linked to the outcome. So it shows how that theory goes. Anatomy of a driver diagram. I think it shows you around the thinking, the development of those primary drivers and what your aim is. And then you get down into the more specific change ideas. And that's where the action period starts, about how we're going to start taking some of those clear ideas and get into action about testing them and doing things differently. So the components of a driver diagram, we start with the end in mind. We have an aim. The desired outcome. How much are we going to improve? By when? For whom? What is the system that we're looking at? And it's a good idea to include that in your aim statement. So if you were talking about a specific unit, your forensic unit, are you thinking about your community? And you could scope that down. So that helps a lot as well in your driver diagram when you're thinking about what level of the system are you working at. The drivers are levers that will impact. So when we're looking at the drivers or the levers of where you're going to have some major action or things that would need to change in your system, those are your primary drivers. Your secondary drivers tend to be key processes that are going on within the organisation. Some of the norms, the norm behaviour, policies and procedure. And then you get further down to what are the specific change ideas. And it's really useful that they are linked, your change ideas are linked, and your driver diagram ideas are linked to your PDSA cycles. So what you're changing, there should be a causal link. Does that make sense? I've done that. I'll just go back a little more in detail. And when you're developing these, getting specific change ideas from the people that have the experience and the expertise there, which includes our service users, whānau, people working in the system. What are their specific change ideas? And I think it's very important in developing your driver diagram that you include those. It's a really important piece of what we do. And also about deciding and prioritising what areas are you going to test and using some tools around what is going to be the biggest impact for the least amount of effort, and that you have a high degree of belief that that's going to make a difference. Because that's important. People want to have a high degree of belief before they're really willing to change things. So this I talked about briefly is about predicted impact, about what is the change idea you're thinking? Is it linked to our theory? Do we believe that it's going to make a difference? And this is just an example of a tool that you can use around that. So how do you create your improvement theory? Well, you look at what the evidence and the literature is saying. We've learned some more today around smoking cessation. You use the information that you got in your co-design, those people with experience in the services. You look around and lift your gaze and look what we know internationally, what we know works down the road. What have they learned? And it's about all teach, all learn. And also about what is your current system doing? What do we know about our system, how it's performing, why do we believe it's occurring that way, and what we could do differently around that. Then we get into PDSAs, and PDSAs are used to confirm that our theory is correct, that we test some of those assumptions and that what we believe is going on, and so that we actually find out, yes, the theory is sound and we need to find a way to do that, or actually, this isn't where the best, this isn't going to make a difference. And sometimes we will learn that we're working in the wrong areas to achieve that, and that's why it's really important for the next slide is measurement. Measurement helps us learn if our changes are making a difference and our theory is correct. So you can see when we talk about these things how everything is linked to learning our way to improvement. So I've talked about linking your metrics. So you need to think about, and that's part of today as well, is that nailing down where are the processes, what are the things that we're going to do differently, what are the measures that we're going to know that we've changed that process. And how do we link that and how will we capture that data? And will it have an effect on our intended outcome? Does that make sense? We are going to spend more time in measurement a little bit later, but this is just how it links to our theory. So this is a very busy driver diagram, which I would probably not recommend it be this busy, but it just shows you how you link your process and your balancing measures to your theory. And I think it's a useful driver diagram just to show that linkages about why we're measuring this, because it relates to what we think is going to happen.